So good morning and welcome everyone. This is the first webinar organized by the Cambodian NCD Alliance in collaboration with Sing Health, Duke-NUS, Global Health Institute, and also with support from the Southeast Asia Regional NCD Alliance. During this webinar, we are going to be looking specifically at responses implemented by NCD alliances and other stakeholders in the region in response to the increased vulnerabilities people living with NCDs face during this pandemic. This webinar will provide a valuable opportunity to share information about different initiatives to promote the inclusion of NCDs in national COVID responses and to strengthen the response in general as part of a Build Back Better approach to NCDs in these changing times. As we know, the risks of severe illness and death are much higher for people living with NCDs, particularly people with comorbidities and older people, and we can see how the pandemic is exacerbating the situation for these people due to the effects of the virus, but also a broader range of social and economic factors. So the objectives of this webinar are to provide a forum for regional dialogue and knowledge exchange on the inclusion of NCDs in national COVID responses. Secondly, to highlight strategies and activities which have been implemented to promote the inclusion of NCDs in national and regional preparedness and health system responses. And thirdly, to foster connections between the Cambodian NCD Alliance members and colleagues from other alliances and networks in the region. So moving on to the agenda, we will start with some introductions of our speakers today. We've got 6 speakers in total, and they will be presenting from Cambodia, from the Southeast Asia Regional NCD Alliance, Myanmar, Bangladesh, the Philippines, and Malaysia. And this will be followed by a discussion and question and answer. So please save your questions for the end. Each of the presentations will last around 10 minutes, and we're hoping to have around 20, possibly 25 minutes for a discussion. So before we begin, I'd like to introduce our speakers today. My name is Charlotte, and I'm the coordinator of the Cambodian NCD Alliance. I'm currently working as a consultant after almost 4 years with GIZ Cambodia, working on social health protection, and in the past years on NCDs. I have a master's degree in public health from the London School of Hygiene and Tropical Medicine, and I previously worked on aging and health, nutrition and chronic disease, and maternal health. I also have the privilege of introducing our other speakers today. First of all, we will have Dr. Guha Pradeepa. She's the coordinator of the Southeast Asia Regional NCD Alliance. Dr. Guha is also a senior scientist and head of the Department of Research Operations for the Madras Diabetes Research Foundation in Chennai, India. Dr. Guha's research interests are epidemiology of diabetes and its complications and other non-communicable diseases. She is the co-principal investigator for several diabetes studies in India and globally. Our next speakers are from Bangladesh. Dr. Shamim Talukdar has been leading the non-government organization Eminence Associates for Social Development since its inception in 2003. Eminence acts as a secretariat of 4 national civil society organizations, including the Bangladesh NCD Forum. As a dynamic leader, he extended his current position at global level as the president of the International Society for Urban Health. Under his leadership, Eminence recognized itself as an affiliated member of several international associations, including the International Diabetes Federation, the World Heart Federation, and the Union for International Cancer Control. Professor Shah Monir has worked for 33 years in government services and retired as the Director General of Health Services at the Ministry of Health and Family Welfare for the Government of Bangladesh. He is the advisor of the Bangladesh NCD Forum, a network under Eminence Associates for Social Development. Professor Shah Monir Hossain is a visiting professor of public health at North South University in Dhaka, Bangladesh, and of public health at the Institute of Public Health. Then moving on to our next speaker from Myanmar, Dr. Cho Kang Kong is the Deputy Director General of the Department of Public Health in the Ministry of Health, responsible for the NCD unit in Myanmar. Dr. Chor Kang Kong has a bachelor's degree in medicine and surgery and a master's degree in preventative and social medicine. Then we have our speaker from the Philippines. Mr. Jackie Sarita is the Managing Director of Health Justice Philippines, which is the organization convening the Healthy Philippines Alliance. He has been in public health advocacy for over 10 years and was part of the team that developed the regulations against the interference of industries in the development and implementation of public health policies. As head of Health Justice Philippines, he steered the organization, successfully advocating for the adoption of health promotion as a key public health strategy under the Universal Healthcare Act in the Philippines. And our last speaker today will be Dr. Murali Monesami. He is a public health physician from Malaysia. He completed a master's in community health sciences at the National University of Malaysia and got his PhD in public health at the College of Public Health Sciences in Thailand under an ASEAN Economic Community Scholarship. Dr. Murali was awarded the prestigious Chevening Scholarship in 2015 and is currently the medical director of the National Cancer Society of Malaysia. So I would now like to pass it over to Dr. Guha Pradeepa, who is our first speaker and the chairperson for the Southeast Asia Regional NCD Alliance.
Good morning, one and all. I'm happy to be part of this webinar and representing Southeast Asia Regional Alliance, NCD Alliance. Actually, Dr. Monica, chairperson, was supposed to speak. So in place of her, I'm just representing Southeast Asia region. I would just like to give you, because we have recently started this alliance, we would just give you the brief of what our mission and objectives are, who are the members, and what activities we are undertaking currently. Next slide, please. So just give you a brief background on the non-communicable disease and COVID-19 pandemic in the Southeast Asia region. According to WHO, NCDs account for 92% of all deaths in this region. And the COVID-19 pandemic has a significant impact on people living with non-communicable diseases. Now, COVID-19 cases are increasing in this region. And as of November 23rd, we can see that over 1 crore people have been tested positive for COVID-19, and with over 1,59,000 people reporting deaths. So the current unprecedented moment of crisis calls for greater solidarity and joint action between multiple stakeholders, highlighting the importance of a whole of society approach to deliver well-resourced health systems that responds to all ages. Next slide, please. So our NCD Alliance, the Southeast Asian Region Alliance, was launched in February 2020 during the Global NCD Alliance Forum held at Sharjah. And there we met for the first time, all of us, even though we were in contact through mails, we met personally there, and we sat together and drafted what is the mission, the aims, and all the other activities to be conducted during this launch. The mission of this NCD Alliance is to bring a strong civil society, to build a strong civil society and patients living with NCD-led movement in Southeast Asia region that percolates at the national and subnational levels through country-level NCD alliances, with the aim to minimize the incidence and prevalence of NCDs and to support comprehensive care, treatment, and management in their respective countries. Next slide, please. So we have 10 member alliances in our alliance, and we will be roping in few more. And we have 2 from Bangladesh, which is the Bangladesh Network for NCD Control and Prevention and Bangladesh Non-Communicable Disease Forum. The Healthy India Alliance, which is from India, and Maldives NCD Alliance, Myanmar NCD Alliance, NCDA Lanka, NCD Malaysia, Nepal NCD Alliance, NCDA Indonesia, and Thai NCD Alliance, where the Healthy India Alliance houses the Secretariat of the CR NCD Alliance. Next slide, please. So the office bearers is Dr. Monica Arora, chairperson, and Dr. S.M. Balaji is the Honorary Secretary and myself the coordinator. And we have the governing board members from each of the alliance, the partner alliances. Ms. Aishita Shirwana from Maldives NCD Alliance, Dr. Mahen Vijay Surya from NCD Lanka, Mr. Kenneth Low, who is with us here from NCD Malaysia, Dr. Abhinav Vaidya from Nepal NCD Alliance, Dr. Nanda Fauziana, NCD Indonesia, Dr. Tin Mong from Myanmar NCD Alliance, Professor Sombot from Thailand NCD Alliance, Dr. Monica, as I said, from HIA, Dr. Shamim Talukdar from, he's also with us here now, Bangladesh Non-Communicable Disease Forum, and Professor Sohail Chowdhury from the other Bangladesh network. Next slide, please. So jointly, we have applied for the Solidarity Grant, and we are happy to say that we are recipient of this Solidarity Fund. And the main aim of this, these are the few activities which we have undertaken so far, and I'm just listing out those few. The aim is to prioritize equality treatment, care, and support service for people living with NCDs during the COVID-19 pandemic under the Universal Health Coverage umbrella in the Southeast Asian region. And the objectives of this project or the study which we are going to undertake is to analyze the status of regional preparedness in implementing universal health coverage in the CR region and identify replicable models of people-centered solutions being offered based on the interactions between NCD and the COVID-19. And the second one is to strategically build on advocacy and communication opportunities at both regional and national levels. With these, we have started the activities. Next slide, please. So the main, one of the activities is like during the 73rd session of the World Health Regional Committee of the Southeast Asia, an official statement was developed and released by the Southeast Asia NCD Alliance, which took the data from the NCDA study among the civil society people to prioritize NCD and people living with NCDs in this COVID, the importance, like we need to do more studies and assess their needs and assess their current status. So we have released an official statement during that WHO region committee. And also the CRO NCD had been involved in as a co-signatory to the statement submitted by World Heart Federation, where we have focused on prioritizing cardiovascular disease and circulatory diseases. So this statement was also released through social media like Twitter, Facebook, etc. The next slide, please. The other, we have started involving in the development of needs assessment tool, which has been developed. And this is to undertake the regional situational analysis on preparedness to identify and address the needs of patients living with NCDs within the COVID-19 and UHC context. And data collection is currently under progress. And we are also developing a website for our alliance, which is also in progress. And the capacity building activity is a continuous process, which we are doing regularly. Next slide, please. Thank you. This is as we have just started. So the activities are also minimal, but we would like to add in more members and also continue more activities involving other alliances also. Thank you.
Thank you, Dr. Guha, Pradeepa, for that brilliant overview of the Southeast Asia Regional NCD Alliance. I guess we're not the only newer NCD Alliance. It's great to hear a bit about what you're focusing on in your first year. So I will be presenting on the Cambodian NCD Alliance and also the situation with regards to NCDs and COVID in Cambodia before introducing the Alliance itself and highlighting relevant activities to our webinar theme today. I'm just checking that everyone can see the slides. So in Cambodia, deaths from NCDs have increased from around 46% of all deaths 10 years ago to 64%, or an estimated 64% in 2018. You can see from the graphic on this slide that the most common are cardiovascular diseases, which are responsible for 24% of all deaths, followed by cancer, around 14%, 5% due to respiratory diseases, and 2% due to diabetes. Strokes cause the most deaths in the country, and liver and lung cancer cause the most deaths among all cancer-related deaths each year. To address NCD risk factors, progress has been made in marginally reducing the prevalence of smoking and alcohol consumption, though only 8% of the population are sufficiently active and half do not meet recommended consumption for fruit and vegetables. Rates of overweight and obesity, hypertension, raised cholesterol, and pre-diabetes are also increasing, some at a rapid rate. As an example, pre-diabetes, or impaired fasting glycemia, has more than tripled in recent years. Also, out-of-pocket expenditure is high for people living with NCDs and often leads to catastrophic health expenditure for individuals and for households. A 2015 health financing report by the government estimated that only 7% of health expenditure is spent on NCDs in the country, showing that investment is significantly lacking considering the burden of disease. This figure hasn't changed much since, but there are signs of increasing commitment to investing in the expansion of NCD services. And then moving on to the COVID situation in Cambodia, the first reported case, which was actually very early in this country, it was on January the 3rd, but Cambodia still remains in stage 1 of the outbreak, and there are no signs of outbreaks in the community at the moment. You can see from the slide, as of the 23rd of November, there were 306 identified cases and no deaths have been reported. Cambodia has also been recently praised for its handling of the COVID pandemic, with a new reported finding that the country has controlled the pandemic better than any other country in Asia. And you can see here, it's slightly smaller, but there is a tweet from a few days ago from the Western Pacific Regional Office Director, Dr. Takashi, who's praising the Cambodian response. So Cambodians' biggest challenge now is the economic devastation. So before COVID, Cambodia sustained average GDP growth of 8% between 1998 and 2018, which was actually making it one of the fastest growing economies in the world. And this growth has been driven by 3 key industries: tourism, agriculture, and the textiles or garment industries. Together, these industries account for more than 70% of the country's growth and almost 40% of paid employment. But the pandemic has hit these key industries hard. I've pulled out an example here on the left showing that over 110 garment factories have been forced to close, and that was just on the 22nd of November. It's an important example because the population of Cambodia is around 15.5 million, and the garment or textile industry employs well over 1 million people. And many of those people working in this industry are supporting families and children left behind in the provinces. So you can see how this will have a huge ripple effect. Another sector that's been greatly impacted, which has long-term effects, is the public and private education institutions, which have also faced long closures and have just reopened again this week after another 2-week closure due to the so-called November the 3rd incident, where a Hungarian foreign minister visited the country and was found to be positive on his arrival in Thailand. And this has actually led to a tightening of measures to prevent similar situations. Okay, so moving on to the next slide and the Alliance itself. We officially launched in March 2019 to call for greater action to tackle the rising burden of NCDs, put NCDs on the political agenda, and build a new platform for collaborative action. The Alliance brings together stakeholders working on specific diseases and risk factors across the spectrum, including mental health. The Alliance's member base is slightly different to many other national alliances, as we include both government and non-government stakeholders. In February 2020, we finalized our strategic plan and our priorities for the next 3 years. And there are 3 strategic pillars, which you can see on the slide. These are to advocate, to exchange knowledge, and to collaborate. And here is a picture of some of our members here in February, just before everything changed. Each pillar has a specific goal and 4 outcomes, which the Alliance will work towards over the next 3 years. And the focus for this year has really been to start to articulate a shared agenda with short-term goals that are underpinned by this strategy. Next slide, please. So what has our response to COVID-19 been? With the escalation of the global pandemic and unsure how it would play out in Cambodia, the Alliance shifted its focus and applied for its first grant with the Civil Society Solidarity Fund, who is supporting this webinar today. We were one of 20 national and regional alliances to receive a small grant under the Communications and Advocacy category. The purpose of the grant is to support alliances address the critical needs of people living with NCDs during COVID-19 via advocacy and communications activities. And our project goal, you can see on the slide, is to promote and champion the inclusion of NCDs in public health preparedness and health system strengthening as part of the COVID-19 response, both directly through the Alliance itself and through a network of influencers. So just to highlight some examples of activities in this project, it's a 6-month project. And I think that we've managed to achieve quite a lot in that short time frame, but some of the activities we've conducted include informal discussions with people external to the Alliance, who we are calling influencers, to assess knowledge gaps and opportunities or entry points for messaging and advocacy. We've conducted focus group discussions and interviews with people living with NCDs. We've conducted individual interviews to capture the lived experiences of a few key people, and we produced a short film. I wanted to highlight some of the specific challenges reported by people living with NCDs in Cambodia, which we heard about through the focus group discussions. So people talked about the difficulties affording medicines due to loss of household income, the barriers to accessing medicines and disrupted or delayed care due to physical distancing and restrictions, the increased exposure to mental health risk factors such as anxiety and depression due to the loss of income, social isolation and fears of infection, and an increased exposure to the main NCD risk factors such as an unhealthy diet and a reduction in physical activity. So you can see, even in the context of Cambodia, where cases are very, very low, it's still having a major impact. We are now in the process of finalizing the key outputs from the project, which include a 5-minute film on the impact of COVID on people living with NCDs, a policy brief, several personal stories like the one you can see on the slide, social media graphics, and a short report of the focus group findings. Okay, next slide, please. So just to highlight some of the challenges in Cambodia, NCDs are still a low priority. I've mentioned the low funding allocated to NCDs despite the overwhelming burden, both in terms of morbidity and mortality. We have strong evidence now, or stronger evidence, on both the economic and health benefits of investing in prevention and control, but it's not enough, and we're not seeing fast enough action. The health system is not yet set up to provide essential NCD services for all at the point of need. The pandemic has added greater urgency for the need to integrate NCDs into health system responses to COVID-19, and efforts have been made to expand priority NCD services by the government, but progress has been insufficient, and in the longer term requires further investment and technical capacity to make screening and treatment available for all. Thirdly, identifying high-risk populations for vaccine distribution. In the next year, we will see this being talked about more and more, and as we know, people living with NCDs fall into this high-risk group, particularly those with comorbidities. The challenge for a country like Cambodia is that these people will be identified through health center records, and we know that many people don't access public health facilities. So last year, a study showed that 76% of patients among the poorest quintiles in the country use the private sector as their first point of contact for curative and preventive health services. And the last challenge on this slide is that almost 1/3 of the population are not covered by health insurance. This is around 31%, which is a large proportion, many of whom are in the informal sector and many of whom are financially vulnerable. COVID has exacerbated the situation for many, and the economic downturn and substantial drop in household incomes associated has exposed and deepened these inequalities. But we can see some opportunities, and we see signs of commitment to expand NCD services. Can I just ask everyone to mute if you're just joining later on? So there is a large health project in Cambodia called H-Equip, which is co-funded by the government and the World Bank and several other donors, including Germany, Korea, and Australia. It's in its current phase and is worth around $175 million US, but the negotiations are going on at the moment for the next phase, and we hope to see an even stronger focus on NCDs in this next phase of the project. COVID presents an opportunity to build back better, stronger, more NCD inclusive health systems. We can see from the data that Cambodia has been spared so far, at least in terms of the health or greater health impacts, but the pandemic should shine, or it does, I think, shine a spotlight on the critical need to reorient the health system for chronic disease treatment and care, and ensure that efforts to advance universal health coverage are inclusive of NCDs. We also think that the pandemic could be a catalyst for implementing stricter NCD policy measures, particularly policy measures that can generate revenue, which is much needed at the moment with the economic impact that the pandemic has caused. And we also see a big opportunity for the Alliance itself and for civil society, as we will transition early next year in January to a new arrangement where the Health Action Coordination Committee in Cambodia will take over as the host organization to the Secretariat. And this potentially opens the door to greater civil society engagement in NCDs. And that's my last slide. Next, we have Dr. Shamim Talukdar and Professor Shah Monir.
Can you see this slide?
Yes, we can see it.
So first I will present about the Bangladesh Non-Communicable Disease Forum, then Professor Shah Monir will compliment me regarding the situation and different initiative in Bangladesh regarding the non-communicable disease. Thank you, Cambodian Non-Communicable Disease Alliance and Global NCD Alliance for giving us this opportunity to share the Bangladesh non-communicable disease status in this webinar. First of all, I'd like to share that Bangladesh Non-Communicable Disease Forum we initiated by the Eminence Associate for Social Development, and this forum was established in 2009. It's a little bit, far more earlier stage of Global NCD Alliance formation. And that time, Bangladesh had different association related to the different non-communicable disease, like Bangladesh has a big, large organization called Diabetic Association, Heart Foundation, Cancer Society, and others. And we thought that we may need a common platform to improve the quality of treatment, care, and support for people living with NCDs in Bangladesh. And we initiated that platform, also engaging the professional bodies and different organizations. There was about 14 organizations. We became together and started this forum in 2009 and started to do activities related to the prevention, advocacy, training, and other activities. So that was the history of Non-Communicable Disease Forum. And now we focused on different diseases like We focused on the cardiovascular diseases, diabetes or endocrine-related disease, cancer, chronic obstructive pulmonary disease, mental health-related disease, stroke and injury. I like to share that recently our government did a survey called Vital Strategy Survey, and it found that 67% people died in the non-communicable disease. And among the women, reproductive age group women, the highest cause of the death is cancer. Moreover, if you just go through our daily death ratio, and we found that injury is one of the major cause of the death in Bangladesh, like drowning, suicide, road traffic accident, and others. So we included this as an focus area for our forum. And our mission is to conceive, endorse, propagate, and paraphrase the interface of the evidence topic top practice to practice in terms of ensuring health justice for NCDs. Our vision is to contribute in a community order where people live in an equitable and healthy environment with their maximum potential thought, prevention, treatment, and control of the NCDs. Then what type of activities we do the research activities, and we explore the research for Bangladesh, different non-communicable disease. And our main focus on the research is health system research for NCDs. Then we are trying to do the research on the NCD-related community-based surveillance system, lifestyle change related to NCDs, salt and transfer reduction related policy gaps identification research, and tobacco control among the young generation. Then we do regularly advocacy activities to ensure the multi-sectoral engagement to prevent the NCDs, ensure the access to the drugs for all people with NCDs, ensure quality care services for NCDs at the root level of Bangladesh, and include NCDs for the universal health coverage. We also started to conduct the training for the frontline healthcare service providers, how to provide the NCD-related service at the doorstep in Bangladesh. Then we also started specialized training for the physicians and nurses, palliative care training for the healthcare professional, and public health research training on NCDs, because we thought that research is one of the major agenda for NCD prevention and control. So, frontline health workers also need to understand how to conduct the research, data collection, and methodology. So we started that activities recently. If you look at that 1 decade of the experience of NCDs related activities by the Bangladesh NCD Forum, and we mainly try to engage the civil society organization. Like Bangladesh is a country or land of different NGOs. So we are trying to engage different NGOs for NCD related activities, but still it's a challenge for us, because all the NGOs, they think about the sustainability and resource mobilization in terms to do any activities. So we found that donor and other agencies need to come forward and prioritize these NCDs as a funding areas. So I think that then civil society and NGOs will be more active and can take place in the NCD related activities. Moreover, as per our understanding, we did different type of research activities through the NCD forum as well as from our organization too, engaging the different our partners forum organization related to the type 1, type 2 diabetes, and also some activities with the different partner organization in abroad. So I think that this is a potential scope for any forum in any countries to engage the forum or partner organization to do different type of research activities. So in terms of that experience, we feel that these partners can also play a strong role to establish the surveillance system for the non-communicable disease. It may need some sort of technical expertise, but it is very much possible to engage them and train them to do different type of surveillance system in different developing countries like Bangladesh and other developing countries. Let me share with you that that Bangladesh Non-Communicable Disease Forum has got a solidarity fund to do the advocacy activities related to the NCDs and COVID-19. You may aware that the first Bangladesh experience of the COVID-19 in March 8. After that, we found different urban areas, especially garments worker, poor people are affected by the COVID-19, and they started to get the admission in different hospitals, but the system did not work properly due to the lack of experience how to manage this COVID-19. And more suffering we have seen by the people living with the non-communicable disease. Like someone had myocardial infarction, they went to the hospital, but they did not get any service due to they did not have the COVID test result. So we feel that the health system need to be prepared to handle this double burden of this disease, this communicable disease of like COVID-19 and non-communicable disease like diabetes, hypertension, cancer, and COPD. On this perspective, we had set 3 objectives to do this advocacy activity by getting fund from the Solidarity Fund of the Global NCD Alliance to engage different stakeholders to assess the coping strategy for the NCD healthcare in Bangladesh. Then to advocate among the National Technical Committee for the COVID-19 and policymakers to place the NCD in the treatment and research guide in Bangladesh. And finally, to develop awareness and guide the people with the NCDs for better management of their condition during the COVID-19 pandemic situation in Bangladesh. And on the basis of these 3 objectives, we have been implementing different activities. We started our activities from July, and we are in a final stage of our project activities. And if you look at the activities we have taken for this fund, like for objective 1, we try to strengthening the national NCD related stakeholders. We conducted several webinars. We engaged different stakeholders to talk about the NCD related issues and how we can really ensure the healthcare services prepared to provide the NCD services with COVID-19. We also conducted assessment of the coping strategy by the people as well as the healthcare service providers. In Bangladesh, we lost already a huge number of physicians, doctors, and healthcare professionals due to the COVID-19. So we did a coping strategy. Then we did a situation analysis of the national and local level preparedness. Then we are at the final stage at this moment to prepare a policy brief based on the coping strategy and preparedness. And on the basis of the second objective, after we prepared a policy brief, we have also finalized a joint statement of different stakeholders for including NCDs in the action plan of government of Bangladesh for management of COVID-19. We are going to disseminate of the joint statement with the National Technical Committee for COVID-19, as well as we will share that statement with the NCD Alliance to share with our national, regional, and global WHO. And we also like to share that statement with all the stakeholders participating in today's webinar and our partners of Southeast Asian Regional NCD Alliance and others. then we'll disseminate that joint statement within our policymakers, and hope that NCD Alliance will take forward that statement to the UN agencies, including WHO. Then our objective 3 was to develop communication materials to increase awareness in the community people regarding the NCD management. Then engage media to increase the awareness in the community people regarding NCD management. And in this perspective, these 2 activities, like we organized several webinars, meetings with the journalists, engaging them, and we also develop different communication materials to share through the social media like Facebook and Facebook group. Finally, these awareness activities also we are going to share with our government. Ministry of Health as a specific operational plan called Non-Communicable Disease Control Program Operational Plan, and we're going to share all these materials with that government agencies to disseminate through their channel too. And finally, make people aware regarding the NCDs management during the COVID-19 pandemic in Bangladesh, because in Bangladesh, we have lost more than 6,000 people already, as per government statement. And among the all deaths during this COVID-19, most of the cases had the comorbidities like diabetes, hypertension, COPD, kidney disease. So we thought that it is important to aware people, especially those have the non-communicable disease, to protect themselves by wearing masks and ensuring the social distancing by their own initiative. So people engagement is very important, and protect them by their own knowledge. Finally, our expected outcome of this project, as we shared earlier, that engaging stakeholders to prioritize the NCD management, then policy briefs development to ensure the NCDs will be included in our clinical management, as Bangladesh has a national clinical management guideline for COVID-19. So we are advocating to engage these NCDs issues within the clinical management guideline. A treatment and research guideline will also be developed for ensuring the NCD related activities. And we are also, hope that, a research will be conducted on the NCDs and COVID-19. I'm just sharing with you that through the Global NCD Alliance, we become engaged with the World Heart Federation, and Bangladesh also started to do the research activities engaging the World Heart Federation initiative for clinical assessment of COVID-19 and CBD status. And we engage more than 15 government and private hospitals as a partner of the Bangladesh Non-Communicable Disease Forum. And we hope that these activities will also aware people about the NCD management services and their role to prevent the complication during COVID-19. Finally, Bangladesh Non-Communicable Disease Forum is open for partnership to strengthen the regional and global action on NCDs. As we are engaged with the Southeast Asian regional NCD alliances, we are active partner of the Southeast Asian regional alliances. But I feel that I like to thank Cambodian NCD Alliance for giving us this opportunity to introduce us with the different partners in Cambodia and other countries who are presenting in this webinar. I hope that our presentation and our arts to request you to come forward, develop partnership, exchange knowledge, and work together. Thank you so much for giving me this opportunity. Now, I'd like to request Professor Shah sir to share his thought and his experience with you all.
Thank you, Dr. Shamim. it's my opportunity, great opportunity to be over here. And of course, the experiences that has been already explained by the Cambodian group and Indian group was excellent. And Shamim has presented the Bangladesh situation so far. Actually, in Bangladesh, we have a double burden of disease, both communicable and non-communicable diseases as a whole. So the non-communicable disease was not on the priority list, I should say, at least before a decade back. But for the last few years, the government is taking very important priority, giving important priorities to the non-communicable disease. But with the onset of the COVID-19 pandemic, we were really facing big challenges with this non-communicable disease management in the initial 3-4 months, because most of the hospital was not receiving patients of the non-communicable disease. So that was a big challenge, but the government started working with the hospitals and started to make triages in the hospitals so that the COVID-19 and non-communicable disease can be separated. And there was 3 zones: the red zones, yellow zones, and green zones was developed. So now the situation is much more better, but still there are a lot of challenges because the non-communicable disease, those are suffering, are getting care at the non-COVID hospital or non-COVID part of the hospitals, but the patients with COVID-19 who are admitted in the COVID hospital or the COVID part of the general hospitals, they are getting the treatment for the COVID, but it is big challenges in Bangladesh to get treatment of the other non-communicable disease because of the support from the health workers and others is still lacking. So government is taking a big plan for combining this, how to give the multi-sectorial approach for, it's not a multidisciplinary approach for giving the COVID-19 patients, and they have developed the SOP for that. So that is giving a good results. The death rate has reduced. Initially, death rate was quite high. Now the death rate has reduced, but it's still we have around 2% death rate in the country. So that's also big challenges for the country. Unfortunately, Bangladesh is now at a state of community transmissions for the COVID-19. So our case is quite high. It's more than 600,000 cases identified and more than 6,000 deaths so far. In the last few weeks, the case is also increasing. So that's one part. But as overall, about the non-communicable disease, the government of Bangladesh Ministry of Health has a operational plan for non-communicable disease for 5 years, and this plan, the non-communicable disease operational plan, includes a lot of behavioral change communicating activities and screening of the patients, particularly at the grassroots level. So case identification is very important because it's still there are a number of diabetics and hypertension patients are not identified at the primary healthcare systems. So the government is trying to include the screening in the primary healthcare systems. So the initial management and referral to the secondary and tertiary level hospitals, that is one of the main objectives of the non-communicable disease operational plan, including the capacity buildings and some research activities. But still there are challenges about the quality of the care, challenges about the decreasing the risk factors. There are still quite risk factors for the non-communicable disease. So that are the challenges. And finally, one important challenge is still government is trying to build the capacity that emergency care for 24 hours on 7 days at the all level of the healthcare. and this emergency care is available at the tertiary level hospitals, but in the secondary and the primary level hospital, still emergency care is lacking. So that is also big challenges for Bangladesh to combat this non-communicable disease, particularly the heart, cardiovascular diseases, and of course cancer. So that is the situation so far. So Dr. Shamim has already mentioned the project, the activities of the projects and the objectives and the expected outcome of the projects. I'm sure this non-communicable disease forum that has established in 2009 is working with the civil societies as well as the government partners, because I remember at that time when it was established, I was within the government. I was the Director General of Health Service during that period. I'm now a retired person. I'm now working with the WHO for other activities. But anyhow, but at that time, the civil society got support from the government, and the forum started. Now this forum is now working closely with the civil society and the government people. So Eastern public and private partnerships are quite increasing, but still there is some challenges in the private sector. There is some challenges in the non-government sectors. So particularly because of the resources, and non-government sectors are coming. Sometimes is really they are not suffering from the resources. So that is the situation so far in Bangladesh related to the non-communicable disease. And I'm very happy that this webinar has given us the opportunity to exchange the views of the different countries. And of course, I congratulate the organizers of this webinar. Thank you very much. Thank you all.
Thank you very much to both of you. That was really, really fascinating to hear the situation in Bangladesh and to hear how you're responding. We are now going to go over to Myanmar to hear from Dr. Cho Kang Kong. I think the connection is a little bit unstable, but let's see if we can get Dr. Cho Kang Kong on.
Thank you very much. Thank you for giving us an opportunity to share our experience and what we are working in this COVID pandemic, and especially for the NCD. Next slide, please. As you all know that at the other regional countries, we has a big burdens of NCD in our country. According to the statistics, 68% of the people from the mortality are due to major NCDs, and that is according to the WHO estimation. This is proportional mortality from CVD, cancer, chronic respiratory disease, diabetes, and other NCDs, and so also injuries are very high, as similar to the other country situation. Next slide, please. For this COVID-19, the countries experienced the first infection in the January, February, and up till now, yesterday, that we have been tested about 1,059,000 tested, and the positive patient we found that it is the 82,236 positive cases. And as earlier the speakers already mentioned, all the mortalities are contributed from the major NCD. They have one or more the comorbidities from the underlying the NCDs, especially diabetes, hypertension, ischemic heart disease. And this actually now that we have the 1,784 deaths in the country. Next slide, please. Yes, we have the higher level committee to respond to the country pandemic situation for COVID-19. Our state councillor lead the national level central committee for prevention, control, and treatment of the COVID-19. And the country, the Ministry of Health and Sports, in collaboration with the multiple partners, we developed the contingency plan to respond to COVID-19 and implement essential measures inclusive of the NCD interventions. And we have the good opportunity that the government allocate funds for COVID-19 economic recovery plan, and so also for the health centers. And we prepare the new treatment centers in Yangon and Mandalay, and we prepare a lot, numbers of the thousands of the quarantine centers in the country. And we have supplies a lot of adequate amount of the NCD medicine equipment, and for COVID-19, the treatment centers, quarantine centers, and all the health facilities. And in our country altogether, there's around the 330 township, and all the 17 state and region. The most, the prevalence, the disease state region is our former capital Yangon region is the most common cause area of the COVID-19, and it is 80% of the total cases. And we have a good chance that there's so many, the collaboration from the multilateral partners and the donors, the bank, World Bank, ADB, and so also the other multiple partners are playing around to combat the COVID-19 situation up till now. Next slide, please. So also we pay so much attention for the communication strategy to respond to COVID-19. And as for the NCD unit, we tried the best to communicate to the community. And we had some these articles in the state medias. And so also we have the weekly, the question and answer session and the Myanmar televisions. And so also that we successfully conduct the awareness for the diabetes in last 12 of this month, that we has already successfully conducted the World Diabetes Days. And so also we have successfully conducted the World No Tobacco Day in last May, end of May. This all the contribute the awareness of the NCD, and so also for the prevention of the measures and to control so many the interventions as each and every family. And we have also at the online continuous education program and for NCDs and other related diseases. And so also for the NCD treatment care. Next slide, please. Yes, the country has already had the platform for delivering the NCD services at the community center approach at the community level. We had around the 10,000 health centers in the entire country, nearest to the grassroots level people. This is we implement WHO PEN package, prevention and control of the essential non-communicable diseases. And we screen with the targeted group of all the more than 40 over ages. That is the result of the support from the collaboration from the EU, European Union, Habit International, and our Ministry of Health Sport, led by the University of Medicine too. Professor Coco is leading for that, and we also have been supporting for the administration from our Ministry of Health Sports. Up till now, around the 10,000 health centers in the entire country and the community level are providing screening and diagnosis of the hypertension and diabetes. But unfortunately, due to this COVID situation, we have circulated some instruction that the older people should not become in that situation. The people with the underlying hypertension and diabetes should not become, but we continuously communicate to the patient and they ask them to take the medicines, and if necessary, our busy health staff go to their respective villages, respective houses to care the emergency situation. But we resume all the community clinic for diabetes, hypertension, and we have assess the current functioning status with the Global Collect tools. And so also we are now monitoring continuously about the performance of this NCD clinic, especially for screening and diabetes and hypertension. And we have already developed the guideline, the SOP, to reduce the interruption of this NCD services. And we have a special support to the village and wards volunteers to identify the vulnerable population and support from the referral if in case of the emergency and in case of necessary or the uncontrolled diabetes hypertension. And we have already we have the online fitness dance competition to promote the healthy lifestyle. That's the entire country has been performing the online competition. through the social medias and also from the state-owned media television. Next slide, please. So also we pay much attention for the cancer care. As you all know, that all the country has been suffering the interruption of the NCD services, especially for the palliative care and also the treatment of the cancer care, because there's so many restrictions to come to the hospital. The area by area, region-wise and region-wise quarantine procedure, it hindered the treatment and care of the cancer patient. So we have organized the cancer care during COVID webinars and meeting, participated and advised from the international speakers. And we make the prioritization of the risk by risk type of each cancer and how to care the cancer patient in the cancer centers. And we change them the treatment, the schedule, etc. And so also we have the consensus, develop the consensus guideline. This is the efforts from the Myanmar Medical Association and the Myanmar Diabetes Association. And this, we roll out the management of the diabetes during the COVID-19. This, the guideline has been updated guidelines that just recently launched. And all the treatment center in the entire country have to follow this COVID-19 treatment guidelines in treating the diabetes and hypertension, especially for that. Next slide, please. Next slide, please. Yes. And although we are not forgetting about our NCD risk factors, these are some examples of the progress of tobacco control during this hard time, during this COVID-19 period. That we have been moving from the Pretoria hair warning to the plain packaging of the cigarette and the tobacco product. So we have been trying the best within these 3-4 months to draft the notifications of the plain packaging. And now we have already have the first draft, and we have been sending to the concerned legal department under the Attorney General Office. And after getting back the feedback, we will release this notification. And so also we have the multi-sectoral coordinating mechanism set for developing the supervisory committee at all the level of the healthcare administration and the general administration. We also make it happen. And according to the FCTC Article 5.3, then now we've successfully launched within this period in August 2020. We have already have the code of conduct was developed to be followed by the Ministry of Health staff. And here in the picture, we show that the FCTC recognized the Myanmar success to make this a code of conduct in dealing with the tobacco industry, with the government official. And so also we make this the communication through the COVID-19 and the Tobacco Association and Risk campaign in the World No Tobacco Day. In top of that, we have the some collaboration with the City Development Committee of the Naypyidaw Council. This is the current capital here, we are sitting there. And this notification was successfully issued for strengthening tobacco control for the development of the smoke area in the current capital. Next slide, please. We also put in the high priority as a mental health and psychosocial support during COVID-19. We conduct the rapid assessment of the mental health condition among community in September 2020. The result will be announced in the very soonest. This is led by the Professor Ting Wu, or the mental health professor in the country or the University of Medicine. And then we have a head talk on the mental health during COVID-19. So also telemedicines by phone, Viber, Facebook, Messenger from mental health problem. We have so many the contact point in each and every district and regional level hospital. And so also we conduct the psychosocial support through the palliative and inclusive of the palliative care unit of the Yangon General Hospital. Next slide, please. Although we try the best as a developing country and with the limited resources, we have so many challenges. The vast most of the health center resources has been utilized for response to the COVID-19. COVID-19, the response activity has been paid much attention, and the other NCD care are weaker in this current situation. So also there is an unmet need with the preparation of the demand. That's we also, although we prepare, but and especially the second wave has been reaching to up to now the 80,000 cases, So there's we have to follow with the demand. So we are now preparing and now it's a stable situation to respond to control the patient, COVID patient. And so also there's a disruption on the NCD services in the first weeks. So we are now trying the best to be better with the current efforts. And the elderly and NCD patient contracted COVID-19 and lead to the mobility from the comorbidity. Most of the people who are not going outside with the underlying diabetic hypertension, but their family member has to go outside for the earnings in their works and job. So it is not possible. Sometimes it is very much strict at social distancing, the measures in a particular house where sometimes it's very much congested situation. So the people suffer from that. And also private sector clinics are closed due to the strict quarantine practice and measures. After once a patient detected from the one clinic, the hospital or clinic has to be locked down. So the private sector is very much reluctant to open the clinic. Now we are releasing those measures. So now they are now reopening. And NCD patients face difficulty in seeking treatment in early phase of the pandemic, that's I already mentioned. And testing and tracking is also a challenge because now we are now in the stable situation. We had a lot of the diagnostic equipment. Now the country is using the rapid diagnostic test, antigen test, to detect the cases. And so also supply chain disruption due to the mobilizing the travel restriction. So we are now revitalizing it again. Although we have so many challenges, there's a great opportunity for us. Minister of Health and Sports commented very well to keep the NCD agenda as a high priority because the COVID-19 mortality is related mortalities is only 1,700, but the NCD mortalities at the annually, the country has hit by around so much the population that maybe 10 times, 20 times higher the current the COVID mortality. And we have very strong collaboration among partners. And we have high support from the CBO, CSO, where we share in the volunteer networks. And COVID-19 vaccine program has initiated. We'll be submitting the final decision and proposal to Gavi COVAX facility in coming December 7. And now we have already involved in this preparation process. And so also we are thinking of the bilateral agreement for purchase from the others, the potential the vaccine developer. And also we have the digital platform favors the capacity building in continuum healthcare. The country with the leadership with the leadership from our union minister, all the healthcare workers has been distributed one mobile tablet phone. So the communication to and instruction to them is very much easy now. And with the high coverage of the mobile network coverage in the country. And we had adequately procured supplies and equipment for, especially for the NCD. Thank you very much. Next slide. So that is all my presentation. Thank you very much, and warmly welcome your decision, the question. Thank you.
Thank you very much, Dr. Chua Kang Kong. Please save your questions for the end, where we'll have an opportunity to ask questions to all the panelists. And now I'd like to welcome Mr. Jackie Sarita from the Philippines.
Hello, good morning. Mabuhay from the Philippines. As Charlotte has introduced me earlier, I'm the Managing Director of Health Justice Philippines, one of the conveners of and Secretariat of the Healthy Philippines Alliance. Healthy Philippines Alliance was conceptualized. Healthy Philippines Alliance was conceptualized in a consultation meeting conducted in 2017 with different organizations and personalities representing people living with NCDs. At the core of the organization is the need to remain true to the belief that people living with NCDs are in the best position to articulate their issues and concerns. This is an alliance of, by, and for people living with NCDs, aiming to bring to front the discourse on the need to integrate NCD management in public health measures and programs of the government. Similar with many of our ASEAN neighbors, The most prevalent NCDs in the Philippines are respiratory diseases, hypertension, diabetes, and cancers, with the last three as the main causes of NCD-related deaths. The most prevalent risk factors to NCDs in the Philippines are tobacco use, harmful consumption of alcohol, physical inactivity, and unhealthy diet because of high consumption of sodium and sugar. More recently, the government has also recognized diseases related to mental health as NCD since it has become a major concern, particularly in urban and young population. We all know that we all know that the healthcare cost is just a component of the overall NCDs, overall damage NCDs inflicts among our nations. In the Philippines, the economic cost of NCDs is estimated to be around $15 billion US dollars per year. This is equivalent to 5% of the country's gross domestic product. NCDs are causing surge in our country's healthcare costs and social care and welfare support needs, and are contributory to productivity reduction. The UN Interagency Task Force and NCD investment case reported that indirect cost in treating chronic diseases is 9 times higher compared to other diseases. The Philippines have a total of 418,852 COVID cases as of November 2020. Of the total, there are still 33,224 active cases. Majority are in the National Capital Region, which includes the capital city, Manila. The Philippines has the highest infection rate for COVID-19 in Western Pacific region. Since March, the government has imposed quarantine protocol that is constantly being adjusted. Majority of those infected here are 20 to 40 years old, but most deaths reported belong to ages 60 years old and above. Local health authorities have reported that a significant number of COVID-19 cases requiring critical care have comorbidities like hypertension, asthma, or diabetes. In coming up with our recommendations, the Healthy Philippines Alliance conducted several consultation meetings among its members, people living with NCDs, and other stakeholders. Most of our analysis came from direct and actual experiences of people living with NCDs during the time of the quarantine period. Among the major challenges faced by people living with NCDs are brought about by restrictions resulting to inaccessibility of healthcare for people living with NCDs. Many cancer patients and those with kidney problems had issues going to their chemotherapy and dialysis sessions. Some people living with NCDs who require regular medical consultations are unable to visit their respective clinics because of lack of public transportation and stringent quarantine restrictions against people living with NCDs. While healthcare sector eventually shifted to telemedicine, this still faced some issues due to some concerns on digital literacy, e-infrastructure issues, and even affordability and accessibility of mobile devices. The healthcare system and the patients were not also appropriately prepared for the shift to telemedicine. With travel restrictions, some people living with NCDs also raised concern on accessibility and affordability of maintenance medicine. Another major challenge faced by people living with NCD is when most of their hospitals and healthcare providers were overwhelmed by the exponential increase of the COVID-19 patients. Many of the hospitals and healthcare providers, doctors, nurses, and other allied health professionals were engaged to focus on attending to COVID-19 patients. Perhaps one of the most major factor that affected response to COVID-19, which cuts across many structures, government or private, is the government resource management, which were all diverted to COVID response, which under the current circumstance is understandable. However, as is, even before COVID, NCD measures do not get priority attention with meager resources being allotted to programs addressing NCDs in the Philippines. Thus, the dissipation of funding for NCD programs during the beginning of the government's response to COVID pandemic is but expected, unfortunately. To say that COVID-19 pandemic exacerbated the low funding of NCD program is but an understatement. Nevertheless, the COVID-19 pandemic in some way provided a silver lining for the Philippines public health system. This was a time where it was shown that the Philippines is actually very much capable of employing whole of society and whole of government approach in facing a public health problem. Through the interagency task force to address COVID-19, the Philippine government was able to coordinate and integrate different measures, managing public transportation, supply of general merchandise and food, including medicine, healthcare system, public safety, and security, among others. The government also, and perhaps one of the most visible way, engaged the private sector like medical societies, private hospitals, non-health service providers, even civil society groups to support and complement governmental actions. The whole of government and whole of society approach provided, although not nearly as perfect as how it should be, but nevertheless cohesive nationwide response to address a public health problem of this proportion. This global pandemic also opened the eyes of many policymakers and government officials on the need to put premium to public health in the form of developing resilient public health structure that can withstand similar challenges in the future. The Philippine government has now a more pronounced stance on public health as a primordial interest that must be prioritized. And perhaps the most significant development that was brought about by this pandemic is the overall heightened health consciousness among Filipinos. More Filipinos now are open to are health conscious, with more Filipinos responding favorably to encouragement to engage in healthy lifestyle by avoiding vices like alcohol, drugs, and tobacco, living active lives, developing discriminating diet, their mental health, and overall environmental consciousness. We even developed a new terminology we call plantito for men and plantita for women. This refers to those people or to those Filipino who suddenly develop love for plants and gardening during the time of lockdown to grow their own foods and some to manage mental health issues. With this, Healthy Philippines Alliance will have to maximize the momentum built by this resurgence on prioritization of public health by ensuring the policy setting for health standards and measure for the new normal will incorporate a good policy environment to promote NCD measures. This will require linking NCD measures to new normal standards. For example, Healthy Philippines Alliance through Health Justice Philippines were able to integrate healthy environment in the workplace in the handbook issued by the Department of Health for the new normal standards in workplaces. We also sent position papers to legislators on how NCD measures can be integrated in the new normal bill. As a result, we were able to secure a dialogue tomorrow, actually, with the chairperson of the Committee on Health and Demography of the Philippine Senate. We are also implementing a communication plan which will sustain the consciousness of Filipino people on NCD issues. We are in the process of developing a story series which will feature different experiences of people living with NCDs at the time of COVID to raise the awareness of the public of their unique issues and concerns. This will hopefully drumbeat public support to the policy advocacy simultaneously running in the Philippine Congress. Finally, Healthy Philippines Alliance is building its capacity to be the eventual private sector watchdog to make the government accountable for neglect or any inaction that is detrimental to public health in general and NCD in particular. Ultimately, the COVID-19 pandemic has magnified the faults and cracks in all public health care systems. When I say all, I meant every single country, whether successful or not in their response to COVID-19. Each country will take a lesson or two from this experience. We can expect that our governments will do everything they can to make sure that they build a better public health system, and we as advocates must not let this opportunity pass us by and make sure that we integrate programs and policies that address issues and concerns of people living with NCDs in all governmental programs. That's all. Thank you.
Thank you very much, Jackie. That was great. And now I'd like to move over to Malaysia to hand over to Dr. Murali Munasamy.
Good afternoon. It's afternoon already for us. Being conscious of time, I'm so sorry. Let me keep this kind of brief and try to get us to take more questions, hopefully from some of the participants. My name is Murali, and I am the Medical Director of the National Cancer Society of Malaysia. And I'm here this morning, afternoon, where, depending on where you are, to speak to you a little bit about the Malaysian kind of experience pertaining to COVID-19 and NCDs. Could I get a change of slide, please? Okay, so just a very quick kind of picture into our NCD burden. I think like almost everyone else in Southeast Asia, we suffer almost the same kind of burden of NCDs. Some of our data, I think we have a National Health Morbidity Survey, which just concluded towards the end of last year, about 47%, 48% almost cholesterol, CKD about 15.5%, large amounts of cancer, and overall NCDs estimated to account for about 74% of all deaths in Malaysia. And you can see the kind of proportional breakdown in terms of mortality. Cardiovascular disease still leads for us, as well as cancers. And you can see the chronic respiratory diseases and diabetes. Proportionally, of course, I've put down kind of the morbidity picture, and you can see quite a large proportion of our population equally suffers from the kind of NCD burden. Next slide, please. So in terms of COVID-19, on your left side of your screen, you can see this is the yesterday's numbers. So we have a new case count of about 2,188 cases, a total about 58,000, close to about 59,000 cases in total, and that's the breakdown by the different states in Malaysia. As you can see on your right, that's actually kind of a graph that plots the number of daily confirmed cases from March till about November. For those who kind of aren't in the know, Malaysia went through one lockdown series from sometime in the middle of March till about the end of May, mid-June, depending on where you were geographically. And then we had quite a lovely period of a lull. And then now, since about October, November, we've been going into what we are terming as the third wave or the second wave, depending on who you speak to, of the disease, with at this point in time a huge number of cases compared to even the first outbreak. So we have been going through intermittent kind of various lockdown measures depending on where you geographically are, and some states, especially in Borneo, in Sabah, primarily have actually been on total lockdown. And so just depending on where you are the country has been using a policy of geographical lockdown depending on how severe the cases are. Next slide, please. So basically, Now, just a couple of words about NCSM, the organization that I actually am attached to, and the NCD Alliance Malaysia. And so NCSM is actually not-for-profit charity founded in 1966. It's the largest cancer organization in Malaysia, civil society. Work of the society is largely concentrated along three main pillars: health education, health literacy, promotion and policy at various levels from primary school, secondary school, university, colleges, as well as to the community at large. Care, our care pillar, in which we actually run a lot of clinical services in terms of screening for the underprivileged, screening at geographically difficult communities, rural areas, diagnostics for certain kind of diagnostics not available or not easily available within the public sector, and access to treatment as well. So there's quite a robust kind of clinical amount of services that the society actually carries out. And then in terms of support, the society also carries out a lot of psychosocial support, including patient navigation, psychological assistance, counseling, financial counseling, dietetics, oncodietetics, and all these is kind of carried out for cancer patients across the country, both in primarily public hospitals, but also within the private sector as and when the need arises. Now, how are we connected to NCD Malaysia? NCD Malaysia is really an alliance of organizations working in NCD, similar to your country kind of makeups of your country's own NCD alliances. So what's a little different perhaps in Malaysia is NCD Malaysia is a grouping that brings together both professional organizations as well as patient organizations. So it's a mix of a different type of organizations, both clinical professionals, patient groups, patient organizations, as well as disease-based societies. So NCSM is one of the founding partners, alongside the major diabetes, heart, mental health, respiratory, and cancer organizations. So it's a young alliance comparatively. We was founded in 2016, then went into a kind of dormant a period, and it's been reactivated since last year. And NCSM functions as the Secretariat of the Alliance at this point in time, which is why we kind of speak across both the roles of NCSM and NCD. So as you can see, there's a Facebook link to kind of the Facebook page that NCD Malaysia runs. So feel free to take a peek at it if you want to. Could I get a change of slide, please? Thank you. Okay, so I was actually very impressed, as well as very excited with some of the really important work that all our colleagues are doing across Southeast Asia. And I was especially kind of very interested in our colleague from the Ministry of Health Myanmar, and seeing the depth and the breadth of the work that they're doing as well. And so what the society has been doing, and quite a lot of our work is kind of co-shared together with NCD Alliance Malaysia. So I will kind of present some of the work that the society has been doing in response to kind of managing NCDs and COVID-19, and quite a lot of their work has been co-supported by the NCD Alliance as well in terms of overall NCDs. So I think one of the big challenges that we initially have already had is the reduction in our ability to actually run education work, awareness activities for the public. So quite a lot of civil society's roles has actually been to kind of conduct these educational activities. So very quickly, one of the things that we've done is we've moved online across multiple platforms. As you can see, I've put a little kind of graphic, and you can see some of the kind of activities that we start to do online. What is then proven to be very helpful for us is the fact that now we're no longer bounded geographically. Of course, costs of conducting online kind of education talks, awareness activities, this has become much cheaper as well. But what we've also done in terms of kind of driving this response is really has to been to kind of conduct sessions at times and languages which are available or accessible for the public. For example, traditionally, the society does a lot of work in our primary national language, meaning in Malay, and we also have quite a bit of an English outreach. But now, since COVID, we've actually taken an active effort to kind of move to providing content as well as activities in other languages, in Mandarin, in Tamil. These are both regional languages which are spoken in quite a big kind of segmented population, Malaysia, which are using these languages as their primary languages as well. What we also have started doing is training and advocacy in via more online forum, as Dr. Was saying earlier from Myanmar as well. We still continue to persist in kind of working on tobacco control and kind of other NCD risk factor reduction strategies. We recently ran the National Tobacco Control Conference, which was an entirely online conference involving Ministry of Health, various other stakeholders. Actually lasted about 4 days, and we had more than 300 participants. And it was launched by the Director General of Health Malaysia. Also at the same time, we actually launched a report of a study that we carried out in terms of control of tobacco product regulations, kind of a survey that looked at how successfully the government's law or regulatory move in 2019 was to create more smoke-free areas in which we banned smoking in open-air restaurants. And so this was a study that was carried out entirely by civil society, looking at how effective those measures have been. At the same time, we've also continued to contribute to kind of building the knowledge base in terms of COVID and NCD. I worked on one of the modules in I think which in the NCD Academy series, which I think a lot of us have access to. Please feel free to kind of look at that. So we wrote the lesson or the kind of topic on COVID-19, broader NCD considerations on how to manage people living with NCD in terms of mitigate their risk as well as assess their clinical kind of treatment in terms of if and when they did get COVID-19. Sorry, could I get a change of slide, please? In terms of care, two of the kind of big things that we've been doing is one, the society's kind of clinical facilities continue to function, and in fact we've become a low-risk screening and diagnostic center for public sector patients. So what the government has done is, because a lot of the tertiary hospitals which are used for diagnostics screening for cancer have now become more and more COVID-19 hospitals used to treat COVID-19 patients. So in terms of triaging, we've become a low-risk center to which government patients are being sent to continue screening and diagnostic work for cancer. But at this point in time, these patients are now in a much more low-risk setting. So their risk of getting COVID-19 is then reduced by quite a bit. What we've also done is the society has worked very hard to actually raise funds and kind of contribute PPEs and other important supportive materials to government hospitals, to government healthcare workers all throughout the country. And that has been kind of our contribution to the communicable disease effort at this time, to kind of show solidarity as well. Could I get a change of slide? So in terms of support, and this is also has been something that has been very eye-opening for us. One is the fact that very early on, the government actually put in a lot of travel restrictions when we went into lockdown, and a lot of patients, our own patients, as well as some of the patients of our partners, were having difficulties. I think quite a few of our colleagues today shared that as well in their own kind of countries, and NCSM together with other NCD organizations and the NCD Alliance at that time, advocated successfully to the government to actually lift these restrictions so that cancer and other severe NCD patients could travel unhindered to obtain treatment, to get treatment in wherever it is that they did need to get treated at. We continue to kind of provide rations, basic supplies for a lot of severe cancer patients or NCD patients who have also been financially affected by the pandemic, as in they have lost jobs and are now unable to fend for themselves. Well, some of the work that we've done include going into very rural areas to kind of provide them with at least daily rations and necessities that will help them cope, and them and their families kind of cope at this time. What we're also very kind of excited about is at this time, we've moved all our psychosocial support and patient navigation to an online portal. It's we were very lucky in terms of a large foundation, Yayasan Hasanah, which is associated with the Ministry of Finance Malaysia, has given us a grant to actually develop and launch an online portal which allows our volunteers, both in terms of professional clinicians as well as patient survivors who become our patient navigators, to actually navigate patients as well as provide online counseling, psychotherapy, diet consultation. As of yesterday, since the beginning of the pandemic, we've run these numbers at about 4,000 or 5,000 cases that we've actually kind of done sessions on for this. So it's been quite successful, and uptake surprisingly has been quite good as well. This has really allowed us to move beyond our current service provision capabilities, which have been tied to a kind of physical idea as to where our offices are in different areas all throughout the country. But now I have patient navigators, for example, working with patients a couple of thousand kilometers away. So that's been one of the good things that we've managed to do in this pandemic. Next slide, please. So I've just put down really very simply, I think quite a lot of my colleagues today have spoken about very correctly all these kind of various challenges and opportunities. So let me just kind of very quickly delve into two things that I think, as we go into a kind of sustained response to the pandemic, because I think now we're going to need to get adjusted to the idea that COVID is going to be here for quite a while. It's going to perhaps function on a similar kind of line as HIV did in the 80s, 90s. So what you're going to immediately see is you're going to see a competition for resources, and that's going to be one of our biggest challenges in terms of communicable disease versus non-communicable disease. It's not a pretty kind of picture to put out, and a lot of people will kind of be a little not confused, agitated perhaps that this comparison is being drawn, but it's a real comparison. Already we can see non-communicable disease staff on the ground are being pulled away to do contact tracing, to do clinical management of communicable disease patients, namely COVID. So we're going to see that, and this deterioration in terms of resources is especially going to affect our preventive medicine efforts. So this is where we really need to kind of pay attention. There'll also be a lot of delays in screening for chronic disease, diagnosis of NCDs, treatment of NCDs as COVID kind of rises and falls like in those cycles. So those are the two big challenges that I see. Opportunities, I think for us, it's time to learn hard how to do more with so much less. And I think for my colleagues and ourselves in the NGO, the civil society kind of landscape, we've always learned how to do more with almost nothing. So now I think it's a good opportunity that we are able to showcase how well we've become at doing this. And of course, not missing out the opportunity to leverage on digitalization. I was just sharing, I think, with my colleagues the other day on how previously to get like 200 or 300 people to turn out for a talk or a health awareness or education session would actually take us a lot of time, energy and of course money. But now what we've been able to do very successfully is for a session that we run like a clinical like a public awareness session in even any kind of language, turns up a couple of thousand people who attend it online. So this really then the acceptance and the willingness to actually engage in this kind of electronic landscape is really an opportunity that we need to kind of pick up on. So thank you so much for the opportunity, and really a pleasure and an honor to be able to listen to all of you all today. And I am definitely taking home some of your, I'm going to steal some of your ideas to kind of put into practice at where we work. Thank you so much.
Thank you very much, Dr. Morali. That was a really rich presentation with so much great information. And I really agree with your point there at the end about digitalization and tapping into that. I mean, even like, you know, these types of webinars that, yeah, they happened before, but it's just so much easier to organize, and we should leverage these opportunities. So we've only got about 15 minutes left. I just want to say thank you to all of our speakers for presenting such a detailed picture of the situation in your countries and how you're involved in the response. And now I'd like to hand it over to all of the participants who've been sitting very quietly. So if you have any burning questions for any of our presenters, please either write them in the chat box or feel free to unmute yourself. And I think if we can get all the presenters who are still online to pop your video on, just so we can see you, that would be great.
Hi, Charlotte. Can I start to have questions?
Sure, go ahead.
Okay, thank you very much. Thank you for this opportunity, and thank you for the speakers that you spend a lot of time to present your each country in regard of response to COVID-19 and NCDs. This question I like to ask to Dr. Guha. Guha represent, yeah, Guha represent the Southeast Asia NCD Alliance. Yes, my name is Lim Sepon. Currently, I work at Adventist Development and Relief Agency, Cambodia, and also working in the NCDs implementation as well. So this question for you is that how can we help to bring more attention to NCD during the COVID pandemic, or how can we build on what we have learned during the pandemic to make sure government prioritize NCDs and build back better? Thank you. Dr. Guha, did you get my questions?
Yes, I think the signal was weak. Can you repeat?
Yeah, yeah. As working in the civil society organization, what role do you think CSO can play to help bring more attention to NCD during the COVID-19 pandemic? Or how can we build on what we have learned during the pandemic to make sure government prioritize NCDs and build back better?
Okay, so we are actually a part of a sister concern of Dr. Mohan's Diabetes Specialty Center, where we have treatment also going on. During the pandemic, like we used what lessons we learned, how to manage patients during the COVID time who are with affected with diabetes. And we brought in the telemedicine facility. We went to their home. If they actually, during the COVID lockdown, we used a telemedicine facility, which we had all the screening components in the telemedicine van. And we went to their house because they were not able to come. They didn't have access to healthcare. So for all this, we thought if we reach them and we help them out, it would be better. So we had this home care, like going to the house, drawing blood, doing the blood tests. So all this is a lesson learned during the COVID period. this is what we as a civil society, Dr. Mohan's and Madras Diabetes Research Foundation did during the COVID pandemic time. So as a civil society, like, we need to create awareness that they need to, even during this COVID time, that they need to have their the blood checked, their other health things. They have to go to their hospital. If not, at least call them and keep their diabetes or any other NCD under control during this period.
Yes, thank you, Doctor. Thank you very much for your answers. Thank you.
Yeah, thank you.
Thank you, Charlotte.
Thank you. Dr. Morali, I think you wanted to say something. Well, you've raised your hand. I'm not sure if that was intentional or not.
Sorry, I muted myself. Sorry,
Right.
I was just going to add on what Dr. Guha was saying, and Mr. Lim, this might be of use for you as well. So what the approach that we're taking now is, and I think this is very kind of one of the things that we need to leverage on, is the fact that look, having an NCD predisposes you to get a very much more severe form of COVID. I think we've all kind of established the evidence in terms of that. So we just need to leverage on this. So what we're doing is, every single patient that we kind of look at in the community, the idea is, look, let me screen you for NCDs, because then that's going to keep you at lower risk for if you do get COVID, you're going to get a less severe form of COVID. If I can pick up that you have an NCD, and I can kind of treat you if I need to. So that's kind of the talking point that you have to kind of get on to screening people and using that message during this COVID times.
Yes, thank you for your additional responses. Thank you, Doctor. Thank you very much.
Charlotte, can I just add one thing? So recently we've been working with patient engagement groups across ASEAN, actually, and they had an interesting, they made an interesting comment that they didn't even know about the NCD alliances. And I think that's such an important group for them to link with. So maybe we should think about how to not only link within, I mean, there's a great representation just here today, but I think there are opportunities to link to, you know, other advocacy groups also across the different countries. So, you know, we should maybe explore that option and really kind of enlarge the group and the discussion.
Yeah, absolutely. And maybe Dr. Guha, Pradeepa, and colleagues at the Regional NCD Alliance can also be a focal point there for discussions. I think, Dr. Guha, am I right in saying that your alliance is the only regional alliance that's active at the moment?
Which one? The CR NCD Alliance?
Yes.
Yes. We have the Bangladesh and all of them. So we are actively involved now.
Great.
Yeah. We have 10 members, that's what I said. So we are actively involved in collating the data, which we are doing, getting through the Solidarity grant.
Great. And I think national alliances are all at slightly different stages. Some are very well established and very well known in their countries. Others are just starting out or have a slightly different focus. So yeah, I think that's something that we should definitely be looking at in the future. Do any of the other participants have any questions for the panelists?
Hello. Hello, you hear me?
Yeah, please go ahead.
Yeah, hello. I'm working at Kana from Cambodia as a research fellow. I also the Cambodian NCD Alliance members, and also a research fellow for the Asian NCD projects that we work mostly focus on NCD surveillance. So I think a good question from Mr. Sapon earlier, but we would like to hear also maybe from other speakers who may share their experience or their perspective, whether how can the civil society sorry, my voice is a little bit whether how can the civil society playing the role to have like bring more attention to NCD. Like the other speaker also mentioned that the NCD so far is still not really in a good position of the prioritization. But even during this COVID pandemic, if we when I say how can this one, maybe if we can kind of making any dynamic platform to do the mobilization for the resource or any kinds of advocacy to make NCD been prioritized during this period especially. So I think if we can hear more and then getting some more initiative to move forward, that would be more practical learning. Can you please give us more perceptions on this? Thank you.
May I respond on these questions? Actually, the role of civil society is very important because it's not the government can do alone. But most important role that civil society should play is the risk communications and community engagement. Because without the community engagement, and it is very difficult to bring people on board for the good health practices. And also that particularly in these COVID situations, there are a lot of risk factors and the people are not abide with this healthy awareness compliance. So the community engagement is very important, and the role of civil society should be there for bringing the people on board. And similarly, another important part is the advocacy to the policymakers, advocacy, and those who for the health service providers also. So these two important role a civil society should play, particularly during these pandemic situations. Thank you.
Thank you very much, Professor Shah. Does anyone else want to add anything before we go to the next question? Okay, perhaps we can go to the next question. If any of the participants have one, if you'd like to raise your hand or just unmute yourself.
Yeah, Charlotte, I'd like to add two separate questions while that Dr. just mentioned about three most important roles. But how can we bring the government to support us? What is the best way that we can bring the government to prioritize that NCD is most importantly during the COVID-19? So as Dr. just mentioned, only the civil society organization, but how can we advocate to the government so that they can build back better with us? This is my additional questions.
Great, thank you, Supon. So I don't know if any of our other speakers have any examples of successful strategies, or even if Dr. Cho Kang Kong is still online, being a government representative himself, or Professor Shah as someone who used to work in government, if you have any suggestions.
Yes, thank you. I cannot open my camera, but I will talk because yes, as a government official and as in charge for the NCD unit and the ministry, and what we do here in the country is the something like the alliance under the management, under the leadership of our union ministers. We have the what we call the Myanmar Health Steering Committee. This is at the highest level coordination committee, something like the alliance. And it is the bond due to the management of the Global Fund with the HIV/AIDS and other program. Because the HIV/AIDS and the malaria program have so many partners, around the 40 to 100 for each and every particular program. So we really need such a kind of the collaborative efforts and to avoid the overlapping of the implementing area, target population, etc. So we organize such a kind of the MHSCC in short. So this under this MHSCC, these are the dedicated the organogram for the executive working group for HIV, TB, malaria, reproductive health, and so also NCD being the latest one we composed. And this NCD Executive Working Group, we organized. In that NCD Executive Working Group, we have the seat for all the major, the NGO, CVO, CSO. And so also again, under this Executive Working Group for NCD, we have the Technical Strategic Group. That we broadly make these two groups for the prevention of NCD and control NCD. Prevention is for all the NCD risk factors. This is a forum for us. And so also the control means the current burden, how to treatment, screening, early detection, etc. for major NCD again. So this is our structure. And we are always working all the NGO, INGO, all the donor dedicated fund to talk together in this forum. This is our best example, and even during COVID-19, we all collaborate well in this forum, and we are working under the management of our junior minister, and as a chair for this executive working group, I'm chairing for that executive working group. So this is our example. We are paying much attention for the COVID-19 and the NCD. So they are differently, maybe my answer is in a different angle, what you mentioned. I think so many ministerial heads and sports, ministerial heads in the region have been paying attention for the NCD as a priority in COVID-19. So, but you can work in your with your capability and ability and your networks, how you can make happen, whether the prevention, control, advocacy, communication to the community, and even we have such kind of the partners. We're working together with the such kind of the CBO, CSO. Like for example, here in our country, we have the CBO called the People Health Foundation. They are working especially for the tobacco, and so also we are very much collaborating with them. This is quite one good example. Thank you.
Let me supplement here. Actually, the questions that has raised that how this civil society can be engaged with the government support. Actually, it is also the responsibility of the civil society to do the advocacy with the policymakers first, to let them acknowledge the role of civil society in doing all these, not only this NCD, but in all the activities in the health sectors. In Bangladesh, actually, there is a strong linkage between the government and the civil society. And most of these, we have the steering committees headed by the honorable health ministers for these non-communicable disease control, and the civil society, UN organizations and other development partners are also the member of that steering committee. So that gives the opportunity to have the access of the civil society to the government program. And in the government program, there is a non-communicable disease operational plan for the 5 years. Every 5 years, there is a new program. So there is also the scopes for getting the fund from these non-communicable disease activities, particularly for research and risk assessment survey. So that is also another part. During these COVID situations, government has developed a task force, and the national task force is headed by the honorable health ministers and chair. So that's also included the number of the civil society groups as well as the UN and the development partners. So these are the opportunity to work together. But from the civil society side, I think they should always advocate not only to the policymakers, so for the member of the parliaments, and so that it goes to the higher level of the policy making groups, and also with the government counterparts, so that their role can be really recognized by the government. Thank you. Thank you very much.
Dr. Morali, did you raise your hand to add something?
Yes, I did. Just to give kind of a different perspective again, I suppose I'm always giving you the weird ideas. So to Mr. Lim and other colleagues, I think an important question to ask yourselves is, and I think Prof was giving you, Professor was giving you a different perspective of how government needs to include us. We need to kind of put up the advocacy. Sure, all that needs to work as well. But most importantly, government, I mean, like any other relationship, they want to know also what do they get out of you as much as you get out of them. And for example, just to kind of share the example of the National Cancer Society, in the 40s and the 50s, in an almost non-independent country, the society was the first one to actually start off paying for chemotherapy for every single cancer patient, the government in Malaysia. And that's really how the society started. So at all times, even today now, most of our work is together with the government of Malaysia, trying to help to relieve their burden. So we kind of pay for treatment, we pay for diagnostics, we provide psychosocial support for government patients. So because of that, the kind of value that our colleagues, our members and all offer to government services, they always will bring us to the table. There's always an allocation kind of put out for the National Cancer Society. There's always kind of, like if you see within the Malaysian kind of landscape, guidelines, clinical guidelines also will have the National Cancer Society kind of civil society colleagues sitting in the formulation of even clinical guidelines. So at this point in time, when a lot of resources are tight, the government is running out of manpower, it's probably the good time for civil societies, kind of our operatives, our supporters, our members to actually go in to help do stuff for the government in times of this COVID pandemic. And then the kind of good value, the kind of good feel, the trust that you get, then later you can harness on it to kind of get back the returns in terms of them kind of bringing you to the NCD table, perhaps.
Thank you very much for that different perspective. I think I just want to ask all participants if anyone has a last question, because I think people are starting to sign off for lunch.
I just ask one question to you, Charlotte?
Yes, sure, go ahead.
What is your next plan?
Sorry?
What is your plan for next activities?
It's a good question. So as you know, with the Solidarity Fund, it's a 6-month project which finishes at the end of December. We've also just secured some additional funding from Germany to try and strengthen our Secretariat and to really expand our activities and build our coalition of members. But someone else will be taking over this from January, as I'll actually be leaving. And we will transition, as I said in my presentation, to a new host organization, which is the Health Action Coordinating Committee in Cambodia. And they have dozens and dozens of national and international health NGOs, some of which are on this call, who are part of their network. So I'm really hoping that this will help to kind of mobilize greater participation on the NCD front. I guess, depending on what's happening with COVID, I'd like to see some advocacy priorities linked to ensuring that people living with NCDs are prioritized in Cambodia in the rollout of the vaccine. I think that's going to be critical. Yeah, does that answer your question? Yeah.
Charlotte, I think you got a message from Tan
in the chat box.
Yeah.
I'm just reading
so he or she has a question there. So sorry.
From MSF.
Yep.
Thank you for your presentations. Each countries have different contexts to response for NCDs. However, the burden of disease are more or less the same. Means high prevalence. So do we have a model of care for NCDs, a cost-effective model of care that can be introduced to the government? Example from the primary healthcare to national hospital. My question to Charlotte. Yeah, without going into too much detail at this point, and I perhaps would like a colleague and fellow steering committee member of the Alliance here in Cambodia to step in, Moritz, but I'm not sure if he's still online. I think there are some successful and cost-effective models at the community level. The question is what appetite there is on the government side to take on these models and expand them, because they have been shown to be successful. The one I'm thinking about is particularly for diabetes, which many of us here in Cambodia know about, with the peer support groups operating across the country. But this is currently led by Maputsio, diabetes organization, not by the government. I think Moritz, are you there, or have you signed off? Maybe we can pick up this conversation offline as well. I'm just very aware of the time, it's approaching 12:15, and yeah, I want to just thank again all of our presenters for taking the time to share your really insightful presentations about the really wide range and diverse activities happening in each country and even in the region. We will be making a recording of the webinar available, so we will share that, and please look out for the Cambodian NCD Alliance on Twitter. I will maybe send our Twitter handle out in the follow-up along with the link for the recording to participants. And lastly, I'd like to just thank those who made this project possible, because this webinar is happening due to the support of the Solidarity Fund, Civil Society Solidarity Fund on NCDs and COVID-19, which has been generously funded by the Leona M. and Harry B. Helmsley Charitable Trust, Access Accelerated, Takeda, AstraZeneca, and Upjohn Pfizer. Yeah, so with that, I'd like to end this webinar and thank you everyone for your participation. I hope you've enjoyed it and got something out of it today.
Thank you.
Thank
Thank
you
you very much.
Thank you.
Thank you.
Thank you.
Thank you. Bye-bye.